You're watching TVC Breakfast. It's now 2 years since Nigeria began its COVID-19 response aimed at curbing the spread of the disease. So far, the country has recorded more than 250,000 cases, while more than 3,000 people have died from COVID-19 related complications. According to the National Primary Health Care Development Agency, more than 8 million Nigerians are fully vaccinated. The Nigeria Center for Disease Control says despite the prevailing pandemic fatigue, COVID-19 is still a global reality with the risk of emergence of dangerous variants. Joining me to discuss these ways to curb the spread of COVID-19 is the CEO, Private Sector Health Alliance of Nigeria, Tinuola Akimbolagbe. Thank you so much for being on TVC Breakfast this morning.
Thank you. Thank you for having me.
We all knew the way we felt when we first heard of COVID-19. It was as if the world was just going to end. But where are we in the fight against this COVID-19? Are we still on track?
Yes, definitely we're on track. In Nigeria, we've seen a lot of people, get their vaccines, have a lot more awareness. I think the most important thing really is awareness. Yeah. So before, the major problem was the lack of knowledge about the COVID pandemic and all the effects and all the things that we could do to prevent it and to better manage it. I think the government has been very active, very proactive by setting up the presidential task force on the COVID pandemic. And I think that's one of the major reasons why we were able to have quite a good outcome. I wouldn't say it's been entirely 100% good, but comparatively, compared to other countries, I think Nigeria had a relatively good outcome. Well,
since you say we're on track, but I just wanted to see this, delve more into this by asking you, because we have only 4% of the 200 million population of Nigeria that, that's 8,145,416 persons have been fully vaccinated as against the virus, and only 21% of the Nigerians have been tested for COVID-19 2 years after this. This is just somewhat, how do you adduce this to the fact that the WHO, or is it a shortfall of the requirements of the WHO?
Well, ideally, we should have a lot more people vaccinated. We should have close to 50% of the population vaccinated for us to even have some level of comfort in the outcomes eventually. The NPHCDA, the National Primary Health Care Development Agency, is primarily in charge of immunizations, and they've done quite a bit. But when you look at the statistics, you find states like Nasarawa, Jigawa, they've done a lot. In those states, you have close to 50% already. So what are they doing in those states that we need to translate to the rest of the nation? You find that there's a lot of mistrust in the system generally, even globally. And so people tend to shy away from having their vaccinations. I think it's wonderful that the government has made it mandatory, particularly at the federal government level, and some states have followed suit. But I think also it's not enough to coerce people into getting something. It's better to educate them and let them understand. PSHAN, the Private Sector Health Alliance of Nigeria, has been at the forefront of this fight. Our founders and directors were right at the start, over a year ago, involved heavily in COVID, which managed to raise over 30 billion from the private sector, strictly from the private sector, to intervene. So we're not relenting on that. There's still a lot going on, a lot of advocacy. At PSHAN, we have a program which we call the COVID Advocacy Program, which is running this year. We also have a vaccine hesitancy assessment in Nigeria. That's a program to really find out the inner reasons, the underlying reasons why people are hesitating to get the vaccines. But I think once we can build up the public confidence in the vaccine and explain why it needs to be done, and bring some religious leaders and traditional leaders on board, because in Nigeria we tend to trust these people and say that, well, if they can vouch for it, we've had the president, the governors go and have their vaccinations publicly done, which also helped in the trust aspect. I do think we're on course, and the NPHCDA is doing quite a good job.
Well, some of these things that you wrote out as some of the things that were said at the initial stage, that Nigerians, they're going to make use of the religious leaders some people that are close to them, the opinion leaders and so on and so forth. But still, where we are supposed to, have more than people who go to the streets, talk to people, they will still tell you, no, it's not possible. COVID-19 is not real. It's all a scam. So
yes.
Is it that this is not really giving us the desired result at the end of the day?
It is, but we could do more. We could do more. I mean, we do have a lot of public figures who have not been as vocal as they could be. And I think that's because they themselves are scared. So I do think the education needs to be, I mean, now we're in the political times. I think Nigerians should step up and ask any aspiring political leader, what are you planning to do for healthcare? And I think if we have a lot more people come out positively about that. I mean, we have international bodies, we have Gavi, we have a lot of people trying to make inroads. We have the COVAX initiative, which has brought us quite a lot of vaccines in Nigeria. I think also we should look more at having the vaccines that have just one shot. The instances of compliance would be higher than that.
Instead of having to take one dose, second dose, and a booster shot.
Exactly. So if we try to get more of the vaccines that with just one shot, you're at least fully immunized, and then you can then say you want a booster shot later, that would also increase compliance.
Do you think this will be made possible with the WHO now recognizing or commissioning some countries, Nigeria one of them, Egypt, saying that they should also, have a homegrown, developing
definitely
vaccine? So is it possible that we can have this one single shot?
Yeah,
and
definitely.
that will take care of it all?
I do think Nigeria is very lucky to have been included in the countries that now have the capacity and will build up the capacity and the licensing to be able to produce vaccines in-house. When you eliminate the logistics of actually shipping the vaccines from other countries, and you have to understand, it's a situation where everybody is looking out for their own citizens. So if I'm, for instance, India, and I'm producing vaccines, my first priority will be my own citizens before I look to exporting to other countries. So obviously, if we can produce the vaccines at home, I mean, apart from the economic benefits, job creation and all that capacity building, the direct benefits of having access to more vaccines is immediately there.
So if you look at the non-pharmaceutical measures, the use of face masks, washing of hands, do this, do not do that, and all of these things that were read out in the media, it's just that people are not doing that again. If I still want to go out, I make sure I use face masks. And
yes.
We have relapsed.
Exactly.
People look at you and they ask you, why are you still using face mask? Nothing is happening
a lot
of
places I go to, I'm the only one wearing a face mask, and people make jokes, it's because you're a doctor. I said, no, it's because I'm informed and I don't plan to catch whichever new variant comes up. Because the truth is, whilst we do not have as many people vaccinated as we should have, there are going to be more variants. They may not be as bad, or they could be worse. So the truth is, we still have to continue to publicize the non-pharmaceutical interventions, face mask, wash, keep a distance. Yes, we have to emphasize that.
Compare the Nigerian climate to, and some conspiracy theories or some other insinuations that, okay, so far we've not recorded up to 3,500 deaths. It's just a bit over, well, one death is, deaths too many. So this heartbreaking, but it's just about 3,100 something number of figure of deaths that we've recorded in this country compared to the western part of this country. I mean, western part of the world, and some other places where we recorded more in hundreds of thousands of deaths. And they say that our climate is very favorable, or we are strong Africans, and some of these things are the white man's diseases. So
yes, I mean, we hear those myths. There's nothing like stronger African. I must say, relatively, compared to the global outlook, it looks like we've had less mortality. But you'll have anybody in the medical field tell you that the numbers we have are underreported. We definitely have much more than that. So a lot of people in Nigeria, they die like, well, is God's fate type of thing.
Because people do not go to the hospital.
Yeah, people don't go to the hospital. Our health seeking behavior is not where it should be. So obviously the numbers are underreported. Nevertheless, we do have slightly lower numbers. There appears to be some factors which we have not yet identified. It could be genetic, which seem to have, I wouldn't say protective, but we do not seem to have had as bad an outcome as you have in other climes. Nevertheless, for every life that is lost, that is a waste of resources, that is a loss of someone who is precious. So every single life, so there's no way to discount a life and say, well, we only lost 3,500. Even if we lost 35,000 people, that's 35,000 too many. But we do have a lot of issues in the health space and a lot of economic issues, and then people say, well, COVID is not my reality. I don't have food to eat and my kids have to go to school and all that. But it's a major factor. And if we look at the effect that it's had on the economy, we see that it has affected all of us. So I don't think anybody can afford to say, well, this doesn't concern me. It concerns you either directly or indirectly through other countries that it concerns and has a ripple effect on Nigeria.
Take this to the street and they'll tell you that what is killing people is poverty. What is killing people, I'd rather be on the streets rather than to, remember the lockdown period saying, I don't have money. So what is killing people is poverty. And then that's just a myth as well. But the reality is, during the breakout, when we had the story about the HIV and AIDS, the outbreak of AIDS, saying, okay, you have to do this, you have to do that. Now, we really don't talk much about, the HIV and AIDS of a thing, and the focus has not really been on COVID-19. Look at malaria, the #1 killer, disease. So, is it that there's something like a misplaced priority here, some way?
No. So when we look at the conditions that have the highest mortality in Nigeria, I mean, obviously, malaria, pneumonia, childhood diseases, some chronic conditions, and all that, yes. We have enough health problems to go around. That's the truth of it. We have more than enough health problems to go around. But everyone is just as important as the other. Some are of a greater priority, and that's why organizations like my own, the Private Sector Health Alliance of Nigeria, is saying we cannot afford to stand aloof. The private sector has to get involved. By private sector, I'm referring to the private business sector. So we have to look at, if we do not get involved in the health sector, it has ramifications for our economic prosperity. It has ramifications for our business operations. During the lockdown, nobody was able to work. We were all locked down at home. So the private sector must actively get involved in the health sector in Nigeria.
Speak to the number of healthcare centers that we have in this country and the issue that sprung up during the COVID-19, the crisis, saying medical doctors, are traveling abroad, they're experiencing brain drain here and there. Speak to the fact that, to the issue where we don't have enough medical, healthcare centers and all that, and what the government should be doing. Should we have more private, or the government should be funding more, pumping more money into the healthcare, sector?
Well, when we look at statistics, where do the bulk of the populace get their healthcare services? It should be at the primary healthcare center, at the primary healthcare level, and that should attend to 70 to 80% of cases. Unfortunately, that's not what we have. What we have is a lot of people go to secondary care centers because the primary health care centers do not have much in the way of services to offer. Less than 30% of our primary health care centers nationwide have the facility, the resources, the capacity to actually meet the patient's needs. So at PSHAN, we've launched an initiative. It will be formally launched at the end of Q1, which we're calling the Adopt a PHC scheme, where we're having members of the business sector get involved. We're looking to build, renovate, or just fully revitalize 774 primary healthcare centers, one in each local government area of Nigeria. It's a huge project. We're working in tandem with the National Primary Healthcare Development Agency. They also have their own projections and their plan. But what we're saying is the private sector and the public sector should not be in separate silos. That line of division should be removed. There should be more active public-private partnerships so that for the betterment of Nigeria, you see that a lot of people in the private sector, the private business sector, are interested in investing in healthcare, both for CSR purposes, for sustainability, but they tell you that if I give my money to the government or the local government, I'm not really sure what happens to it.
Correct.
So PSHAN is saying we're a neutral body, we're a credible body, we are a medium between the private sector and the public sector, and we have transparency, integrity, and we can pool all your resources together. So if you have one business that comes and says, I want to paint the primary healthcare center in my local government area. Somebody else says, I want to donate a bed. Someone says, I want to donate medication. Each of them in their own right is doing well. But imagine if you put all those resources together, then you find that those changes can be sustained. So when people go and they paint primary healthcare centers or donate machines, you go back in 3 or 4 months, everything is back to the way it was. The machine has broken down, there are no funds to run it, there are no maintenance agreements in place, things like that. And so PSHAN is mobilizing the private sector. We've had a lot of interest from the banking sector, from the oil and gas sector, manufacturing, service sectors, saying we want to give back, but we want to give back in a manner that is credible, in a manner that is transparent, and in a manner that is sustainable. We want to see what our money is being used for, and we want the government to make it worth our while. Because remember, the business sector are not the government. It is the role of the government to protect the citizens, to provide welfare, security. So if the private sector is stepping in, then you must provide an enabling environment. You must say, we'll give you some tax credits, or we'll give you some incentives so that this can be done. And that is where we come in. You know, we're not waiting for the government. This initiative is entirely private sector led, entirely private sector funded. But it's just to show that it can be done.
So if people, because some, if you tell them this is a private health center and then this is a secondary, healthcare center as well, they really don't know the difference. All they know is a hospital, is a clinic. I just go there to get healed. So how do we bring this into the consciousness of people, making them understand that no, if you are suffering this or if you're experiencing this, this is where you need to go?
Yeah, you'd be surprised that people do know about the primary healthcare systems, but because they failed them in the past, they don't go there. So you'll find out that the way the primary health systems are developed, there's one in every ward. There's one in every local government. It's near the people, it's at the grassroots, it's at arm's length. But because they've gone there, the door was locked, there was nobody on duty, or someone was on duty, but there were no medication, there was no power. So what we are doing is we're actually looking at the entire value chain. We're providing power, we're providing portable water, we're providing infrastructure, building. We're also going to do human resources, payroll, capacity building, training, governance. And it's not going to be run as a private center. It's going to be handed over to the local government, but it would be, I wouldn't call it a BOT, but something similar. We would lease that facility, run it under the ambit of the local government.
So you're looking at a particular state, or you're looking at across nation?
Across nation. We've started with our pilot. We're looking at states that are quite serious and have looked at the demand side. So one of our criteria is that states that have actually started some type of health insurance, mandatory health insurance. Delta State is one of the states in Nigeria that has achieved that. As at last count, I think they had over 1 million Delta State residents enrolled. When you look at that, it doesn't sound like a lot, but when you look at the National Health Insurance Scheme, which covers the whole of Nigeria, has just about 5 million, and then one state has 1 million. Imagine if that translates across all the states and the Federal Capital Territory. Then we'd have 37 million Nigerians enrolled. That's a huge number.
So let's bring it back to the COVID-19 pandemic.
Yes.
There has been much research into how the thing, how this virus actually originated. Wuhan, China has been pointed, accusing finger has been pointed there. They said no. Now again, another report is coming out and still pointing at that particular place. If we don't understand the origin, how do we prevent, or how do we completely phase away or deal with COVID-19?
Well, the truth of it is there are new infections every day. There are so many new infections. We have viruses even falling to the earth from space. We have zoonotic infections which cross over from animals to humans. And whilst we continue to have urbanization and we have people moving into areas that were previously occupied by animals, even look at the HIV. How did HIV come about? It came from simian SIV, which is a form of HIV in monkeys. And so we found that when people were butchering bush meat and all that, it crossed the human blood-brain barrier, and then we had. So, I mean, I'd leave it to the virologists. There's no point getting involved with all the controversial issues. The thing is, we now have the COVID-19 pandemic. It's very important we find out how it came to be so that we can use that knowledge to prevent others. But the truth is, we just need to prepare.
Yeah.
If you're from a science background, you understand that there will be another infection.
So I'm being told to actually bring this to a close, but then in a nutshell, how do we prevent, what do we need to do to prevent a future pandemic? Because there's this prognosis that there will always be pandemic upon pandemics, but how do we prevent and get ready for future pandemics?
I think the basics of sanitation, you know, good hygiene, good water, immunization, things like that. Those are the things that have been the mainstay, and that is what you've seen where third world countries have emerged into second world and first world countries. And so it's for Africa and for those of us still in the developing regions of the world to stick to those standard principles of infection, prevention and control.
All right, thank you very much for this insightful conversation. CEO, Private Sector Health Alliance of Nigeria, Tinuola Akinbolagbe.
Thank you so much for having me. Thank you.